Welcome to the Seasoned Sonographer, the podcast where experience meets education in the world of OBGYN ultrasound. My name is Lynn Flam, and I'll be your host. I'm a registered diagnostic medical sonographer with over 32 years of experience, most of that time in OBGYN ultrasound. Through this podcast, I'm here to share insights, tips, and case studies to help you sharpen your skills and optimize your scans. Whether you're just starting out or you're a seasoned pro, this is the place to grow your knowledge and confidence. Let's dive into today's episode. Welcome back to the Seasoned Sonographer. Today we'll be talking about the cervix length and how it can impact pregnancy outcomes. Why does the cervix length matter? Because it can change the clinical management of a person's pregnancy. It can prevent preterm birth. ACOG recommends that you perform a cervix length at every anatomy screen between 18 and 22 weeks to check for any signs of preterm labor and delivery. Even if they're low risk or asymptomatic, you check that cervix with every anatomy screen. You can look transabdominally first. If you get a good look, measure it from that way. The ideal method for measuring the cervical length is using the transvaginal probe. When you measure the cervical length, you want the patient in lithotomy position. You want to use the vaginal probe, and you'll insert that vaginal probe into the vagina gently. You will image the cervix in the longitudinal plane. You'll image that cervical canal, the white line running from the internal os to the external os. You want to make sure that's lengthened out and you get the longest portion of the cervix. Once you image that, pull back on your probe a little bit so that you're not applying so much pressure. You can falsely elongate it and obscure your measurements if you're putting too much pressure on that cervix. And this is a measurement that's got to be accurate. So take the pressure off by pulling back on that vaginal probe. When you measure the cervix, you want to measure from the internal os to the external os using the straight line method, going through that cervical canal and document the measurement. A normal cervical length should measure 2.5 centimeters or greater. Anything less than 2.5 centimeters could indicate an increased risk for preterm delivery. Next, you'll have the patient perform the Valsalva maneuver. That is where they bear down or cough, or it's as if they're having a bowel movement. They put that pressure on that pelvic floor. When they are doing that, you want to capture the image. What I do is freeze it, cine back to capture that Valsalva, and then measure, putting your caliper at the internal os, tracing it through the cervical canal to the external os. Then you're going to look at the cervix, let it go back to its normal state. Then you're going to perform the fundal pressure maneuver, where you'll apply your hand to the patient's uterine fundus. Your other hand is on the transvaginal probe, and you're going to apply pressure with that hand pushing down on the fundus of the uterus, creating pressure, and you'll watch that cervix for any shortening or funneling, just like you did with the Valsalva maneuver. Freeze, cine back, capture that fundal pressure change, and measure again from the internal os through the cervical canal to the external os, and that should be documented as your fundal pressure in a longitudinal plane. There are two types of funneling, the V-shaped funneling and the U-shaped funneling. The U-shaped funneling has a higher risk of preterm labor and delivery. Risk factors that can change the management of cervix length are twins or multiples, history of a leap, or history of preterm labor and delivery. If they have those risk factors, the provider will likely get a cervical length starting at 16 weeks, going to 24 weeks weekly. And so you're checking again for any signs of preterm labor and delivery with cervical shortening and or funneling. Your role as a sonographer is everything. Accuracy is everything. Here's where we shine. Millimeters matter. Your measurements matter. They're very specific. You want to be transvaginal. You want the patient to have an empty bladder. You want minimal probe pressure. And you want a clear visualization of that cervical canal and that internal os and external os. Take multiple measurements and record all of them. Here's the truth. Our measurement can literally influence whether a patient gets a cerclage, a progesterone hormone, or just reassurance. It's a huge responsibility, but here is a huge opportunity for you to make a difference. To all my sonographers, remember, when you are measuring that cervix, you are delivering insight, you're guiding care, and potentially preventing a preterm birth. Measure with meaning. Before we wrap up today's episode, I'm honored to introduce a special guest, Dr. Morgan Torrez. Welcome.
Thank you for having me.
Yes, Dr. Torrez is a board-certified OBGYN physician, and she has extensive experience in prenatal care, ultrasound interpretation, and the clinical management that follows that. In this segment, Dr. Torrez joins me to discuss a real patient case where cervix length measurements played a significant role in the clinical decision-making. It's a great example of how accurate imaging and interpretation can shape outcomes and why our roles as sonographers is so vital. Let's dive in. So this past week, a patient came in for a routine anatomy scan. She was 19 weeks and 3 days, G1, P0, no risk factors. I started the anatomy screen transabdominally and was looking midline longitudinal at the cervix and lower uterine segment. I noticed there was some funneling, and so at the end of the anatomy scan, I looked vaginally to get a better look. And indeed, there was V-shaped funneling and the cervix was short. The cervix length was 1.67 centimeters. With Valsalva, it was 1.52 centimeters. And with fundal pressure is 1.35 centimeters. Dr. Torrez, how did this information change the clinical management? And can you tell us what happened next when you received this information?
Well, thank you. Yes, I'd be more than happy to elaborate. So one of the reasons why we recommend having screening cervical lengths for all pregnancies to be completed, irregardless of risk factors, during the anatomy ultrasound is that cervical shortening can occur without risk factors, and it gives us an opportunity to intervene. And so a part of my evaluation, when I get an ultrasound finding that demonstrates cervical shortening or a cervical length less than 2.5 millimeters, is that I first need to assess the patient if she's having any symptoms. And for this particular patient, she was completely asymptomatic. She felt fine, no bleeding, no contractions, no pelvic pressure. The next part of my assessment, especially if we can visualize any sort of funneling on the ultrasound, is to make sure that we're not missing true dilation. And so the next part of my evaluation is physically examining the cervix. Usually I look at it with a speculum and a pelvic exam, and then I will actually do a digital cervical exam. So on exam, she was noted to have 1 centimeter of dilation in her cervix on digital exam, meaning that her cervix was actually dilated, not just shortened. The reason why this is important and clinically significant is that is a significant risk factor for preterm birth, particularly pre-viable preterm birth, meaning a birth where we cannot do interventions and that pregnancy and that baby will pass away. Okay. The reason why this is so important is that after that evaluation, we have interventions that we can offer that patient to help prevent that preterm birth. And for patients who are dilated pre-viably, we can offer something called a cerclage, which is ultimately what this patient ended up getting, is where we do a surgical intervention to apply a stitch to the cervix in order to maintain its length. And this will decrease the risk of preterm birth. And more importantly, it will help prolong the pregnancy to getting to a gestational age at which we can intervene. And this is incredibly helpful and incredibly important to do.
I think you said yesterday that they'll monitor her for 24 hours after the cerclage. And then how does ultrasound come into factor after that as she continues to have visits with you?
Correct. So every institution is different on their protocols. I don't personally place cerclages. We send them to our maternal fetal medicine experts who have a little bit more expertise in that surgical procedure. Typically, they will monitor them, yes, every 24 to 48 hours after the procedure. And again, this varies depending on institution and provider. Certain institutions will continue to evaluate that length of the cervix on ultrasound throughout the pregnancy. Some will reserve that ultrasound unless the patients are experiencing any symptoms, and that kind of varies institution to institution. I usually will defer to our high-risk obstetricians who placed the stitch on what they would prefer us to do, but I've seen it managed both ways, with the idea being that we want to make sure that if we choose to follow it, that we don't identify any further shortening, because a lot of times that cervical length will improve drastically after the placement of that cerclage. So this patient may have had a 1.5 centimeter cervical length prior to the cerclage placement, and then it can go back to normal throughout the pregnancy. And then those cerclages are typically removed near the 36th week of gestation.
Well, thank you so much for coming on today to share how cervix length impacts clinical decisions and how important it is in detecting preterm labor and possible preterm deliveries. Thank you.
You're welcome. Thank you for having me.
Thank you so much for joining me for this episode of the Seasoned Sonographer. If you're interested in improving your OBGYN ultrasound skills and learning more about the field, make sure to subscribe to the Seasoned Sonographer on Apple Podcasts, Spotify, and YouTube. You don't want to miss any of the upcoming episodes. You can also connect with me on Facebook and Instagram at Sonotechniques Academy. Explore more educational resources on the Sonotechniques Academy app, or reach out via email, lynn@sonotechniquesacademy.com. I'd love to hear from you. If you have questions or topics you'd like for me to cover, feel free to reach out. This podcast is for you, and I want to make sure I'm covering the topics that matter most to you and to the ultrasound community. Until next time, keep striving for excellence in your scans, and I'll see you in the next episode of The Seasoned Sonographer. The information provided in this podcast and any accompanying materials is for educational and informational purposes only. It is not intended as a substitute for professional medical advice.